The 9 medications that can secretly trigger dementia in seniors. Did you know that in the time it takes to watch this video, approximately 20 older adults will receive a new dementia diagnosis? That is a staggering rate of 1 person every 66 seconds. But here is the most concerning question. What if this decline is not a natural part of aging, but a consequence of what is inside your medicine cabinet? You have been assured that these common pills are safe, routine, and even necessary for your health. However, recent research is raising a serious alarm. An estimated 99% of seniors are unaware that at least one medication they take could be shrinking the vital memory centers of their brain by more than 28% in less than a single year. Take a moment to consider that. The pharmaceutical industry has reportedly known about these risks for decades. They continue to earn billions of dollars selling the very same drugs that may be speeding up cognitive decline in millions of seniors. In fact, a 2023 study in neurology and aging research found that one class of drugs increased dementia risk by 49% in seniors within just 2 years of use. In this video, we will identify the 9 most dangerous medications known to trigger rapid memory loss and dementia. We will rank them from the commonly overlooked to the most destructive. The medication at number 3 is prescribed to millions for what seems like a minor issue, but it has the potential to shrink key parts of your brain's memory system, and you may have no idea it is happening. Before we begin, we invite you to share in the comments section. What medications do you take on a daily basis? Have you experienced any unexplained brain fog or moments of forgetfulness? We read every comment and aim to provide helpful insights. Your experience matters, and sharing it could be a crucial step in protecting your mind. Don't remain silent when your story could save a life. Now, let's start with our list. We begin at number 9, but do not underestimate its importance. This drug is found in nearly every senior's home and could be silently affecting your brain health right now. Number 9, diphenhydramine, Benadryl. Diphenhydramine is the active ingredient in the common pink pill that millions of people rely on for sleep, allergy relief, or cold symptoms. It is inexpensive, available over the counter, and likely sitting in your medicine cabinet or on your nightstand at this very moment. You may believe you are only using it to get a better night's sleep or to manage seasonal allergies, but the reality of what's happening inside your brain is far more serious. Benadryl can disrupt the function of the hippocampus, the critical region responsible for forming and storing new memories. Benadryl belongs to a class of drugs known as anticholinergics. These drugs work by blocking a brain chemical called acetylcholine. This chemical messenger is essential for your brain to create memories and maintain alertness. As the brain ages, it becomes more dependent on every bit of acetylcholine it has. When a drug like diphenhydramine interferes with this delicate process, the consequences for your cognitive health can be severe. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia compared to those who did not. So, what can you do to safeguard your memory? First, carefully check the labels of any products marked as PM, nighttime, or for allergy relief, as they often contain diphenhydramine, sometimes in disguise. If you need a medication for allergies, newer options like loratadine, sold as Claritin, are much safer for seniors. They do not cross the blood-brain barrier and pose less risk to your cognitive function. Always consult your doctor before stopping any medication, but remember that over-the-counter does not always mean it is safe for long-term use. Next is a medication that is taken by tens of millions of people, promising to protect your heart. But in the process, it may be depriving your brain of an essential building block it needs to function. Number 8, statins. Statins are one of the most prescribed types of medication in the world, particularly for individuals over 60. Their purpose is to lower cholesterol to reduce the risk of heart attack and stroke. The two most common are simvastatin and atorvastatin, sold as Zocor and Lipitor. The problem begins with a misunderstanding of cholesterol. It is not just a concern for your heart, it is vital for your brain. Your brain is composed of nearly 60% fat, and cholesterol is a key component in building and maintaining the myelin sheath. This is the protective layer around your nerves that allows them to send signals quickly and efficiently. When you lower cholesterol too much, you risk depriving your brain of this essential building block. In a 2023 study published in Frontiers in Aging Neuroscience, seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment. The risk was even higher for those on stronger doses. Some patients on these statins have reported a sudden onset of memory loss. They describe frightening moments of being unable to remember common words, recent events, or even how to navigate familiar places like their own neighborhood. These experiences can be terrifying and are often dismissed as simple aging. It is important to know that not all statins carry the same risk. Some, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily and are considered safer from a cognitive standpoint. If you have been taking a statin for years and are experiencing brain fog or forgetfulness, it is time to have a conversation with your doctor. You may be able to switch to a safer alternative or adjust your dose. Don't wait until the damage is irreversible. Coming up, we'll discuss another widely used medication that interferes with your body's ability to absorb nutrients, effectively starving your brain of what it needs to stay sharp. Number 7. Proton pump inhibitors, PPIs. Medications like Prilosec and Nexium are part of a drug class called proton pump inhibitors, or PPIs. They are prescribed to reduce the production of stomach acid to treat conditions like heartburn, GERD, and acid reflux. Many older adults remain on these drugs for years, or even decades, because their symptoms often return when they try to stop. The problem that is rarely mentioned is how PPIs block the absorption of vitamin B12. This vitamin is absolutely essential for protecting the brain and supporting critical functions like memory, concentration, and emotional stability. In a study from 2016 published in JAMA Neurology, researchers examined over 73,000 people aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia compared to non-users. By aggressively lowering stomach acid, PPIs also hinder the body's ability to absorb magnesium and calcium. These minerals are vital for communication between brain cells. Without enough of them, neurons cannot fire correctly, leading to confusion, brain fog, and memory problems that can closely resemble the early stages of Alzheimer's disease. The danger may be even more direct. Research has shown that PPIs can increase the brain's levels of amyloid beta plaques. These are toxic proteins that build up and disrupt brain function, and they are widely considered to be a primary cause of Alzheimer's disease. Fortunately, there are safer ways to manage stomach acid. Speak with your doctor about slowly tapering off your PPI, perhaps by switching to an H2 blocker like famotidine, sold as Pepcid. While H2 blockers are not without their own issues, they are generally considered to have less impact on cognitive function. Additionally, a natural supplement called deglycyrrhizated licorice, DGL, which works by coating and soothing the stomach lining, can help provide relief without harming your brain. Next up is a class of drugs that may feel like a lifesaver at first, but can quickly become a dangerous trap for your mind. Number 6. Benzodiazepines. Benzodiazepines, including drugs like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are commonly prescribed to treat anxiety and insomnia. They work by boosting GABA, a chemical that calms the brain and reduces overactivity. Initially, these drugs can feel like a miracle. They quiet anxious thoughts and help people sleep. But with long-term use, they can become a serious problem, a trap that is difficult to escape. A 2022 study published in the BMJ followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk was even greater with long-acting drugs like diazepam, which can build up in the body's fatty tissues, including the brain. These drugs create a state of chemical sedation that slows down your brain's activity. Over time, this makes it harder for your brain to learn, adapt, and remain flexible. The result is often confusion, memory gaps, and a feeling of emotional numbness. Seniors using these medications often say they feel like they are living in a fog, disconnected from themselves and their loved ones. The most difficult part can be trying to stop. Withdrawal symptoms can be severe, including agitation and intense anxiety, leading people to believe they need the drug when it is actually the cause of their problems. If you have been taking a benzodiazepine for more than a few weeks, do not stop taking it suddenly, as this can be dangerous. Work with your doctor to create a plan to slowly and safely taper off the medication. Safer alternatives, such as the anti-anxiety medication, buspirone, or cognitive behavioral therapy, can provide relief without harming your memory. From sedation, we move to a different mechanism of harm. The next drug is given for a common and embarrassing issue, but it works by directly attacking a key chemical your brain needs for memory. Number 5. Bladder control medications. Oxybutynin, which is sold under the brand name Ditropan, is frequently prescribed to older adults for urinary incontinence or an overactive bladder. At first, it appears to be a simple solution to an inconvenient and often embarrassing problem. No one wants to deal with the stress of frequent bathroom trips. However, this medication works by blocking acetylcholine, the same essential brain chemical affected by Benadryl. Unlike some other drugs with similar effects, oxybutynin can easily cross the blood-brain barrier. This allows it to directly impact the memory centers in the hippocampus, making it particularly hazardous for seniors who use it for long periods. In a 2019 study published in the BMJ, researchers found that people over 65 who took strong medications like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That is a risk increase of nearly 1 in 2. What is deeply concerning is that many seniors are not warned about these cognitive side effects. They are prescribed the drug for bladder control with no mention that it could accelerate their mental decline. The resulting harm, such as confusion, forgetting appointments, or struggling to follow conversations, is then frequently dismissed as a normal sign of aging. Patients often report feeling foggy, forgetting names and appointments, or having difficulty following conversations. These symptoms are rarely connected to the medication until significant cognitive damage has already occurred. If you take oxybutynin and have noticed these changes, it is not your imagination, and you do not have to choose between bladder control and brain health. Safer treatments are available. Newer medications like mirabegron, sold as Myrbetriq, work in a different way and have shown a much lower risk of impacting memory. These drugs do not block acetylcholine and are a much better choice for older adults. Next, we look at a drug that seems like a versatile miracle pill, but is one of the most powerful memory-disrupting medications in circulation. Number 4. Amitriptyline, Elavil. Amitriptyline, sold as Elavil, is an older antidepressant that is still widely used to treat nerve pain, insomnia, and migraines. While it may seem like a versatile medication, it is one of the most powerful anticholinergic drugs available. This means it strongly blocks acetylcholine, the chemical your brain needs for memory and communication between neurons. The cognitive effects of this drug are so significant that they are not just a possibility with long-term use. They are an expectation. The damage occurs silently, with no warning signs at first, just a gradual erosion of brain power that looks exactly like normal aging. In a massive 2015 study published in JAMA Internal Medicine, Researchers examined over 3,400 adults aged 65 and older and found that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. This is a major increase in risk. Tragically, many patients are never informed that this medication could damage their memory. They are prescribed amitriptyline for pain or sleep, and then gradually start to notice symptoms like short-term memory loss, difficulty finding words, and poor concentration. Even a low dose taken nightly over several years can slowly erode brain function, creating a slow, invisible decline that is actually drug-induced cognitive impairment. If you or a family member is taking amitriptyline, it is crucial to speak with a doctor about safer options. For nerve pain, drugs like duloxetine or gabapentin may be effective without the same anticholinergic risk. For sleep, melatonin or low-dose doxepin can be safer alternatives. Now for number 3. This modern antidepressant is often seen as a safe choice, but it hides a dangerous secret that sets it apart from all others in its class. Number 3. Paroxetine, Paxil. Paroxetine, sold under the brand name Paxil, is a common selective serotonin reuptake inhibitor, SSRI, prescribed for depression and anxiety. It is considered a modern antidepressant and is often thought to be safer than older medications. But there is a hidden fact most people, and even some doctors, do not know. Among all the SSRIs, paroxetine is the only one that also has strong anticholinergic properties. This means it interferes with acetylcholine, just like the other drugs we have discussed. This single detail sets it apart from other SSRIs, like sertraline or escitalopram, making it a uniquely dangerous choice for seniors. In a large 2021 review published in Frontiers in Psychiatry, researchers examined the cognitive profiles of elderly patients taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. The study also found that seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The irony is that a drug prescribed to improve mood may end up damaging mental clarity and undermining emotional regulation over time. The solution here is clear. The American Geriatrics Society has placed paroxetine on its Beers criteria list, which identifies medications that are potentially unsafe for older adults. If you are taking this medication, ask your doctor about switching to a safer alternative, like sertraline or escitalopram, which do not carry the same cognitive risks. Next is a class of drugs with a brutal mechanism of action, often used on seniors not because it's necessary, but because it's convenient for caregivers. Number 2, antipsychotics. This category is particularly alarming because many seniors are given these drugs without understanding what they are. Medications like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were developed to treat severe mental illnesses like schizophrenia. Today, however, they are often prescribed off-label to elderly patients in hospitals and nursing homes to manage sleep issues, agitation, or behavioral symptoms of dementia. That's correct. Drugs for severe psychiatric conditions are being used to manage seniors who are simply confused or restless. The results are devastating. In 2022, a comprehensive study in the Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months, even if they had no prior history of dementia. These drugs also significantly increase the risk of stroke and sudden death. These medications work by suppressing dopamine, a brain chemical crucial for motivation, executive function, and memory. When dopamine levels fall, the brain becomes sluggish and unresponsive. Seniors on these drugs often appear emotionally flat or zombified. Their personalities seem to disappear, and family members begin to mourn a loved one who is still physically present. The tragedy is that many families are never told what these drugs do. They just see their loved one declining without knowing the cause is chemical, not natural. If a loved one is taking one of these medications, it is vital to ask their doctor why it was prescribed. Often behavioral issues can be managed without drugs by creating a calm environment, addressing pain, improving sleep routines, or reducing overstimulation. These powerful drugs are too often used for convenience, not medical necessity, with tragic consequences. And now, for the number one most dangerous medication for your brain. It's not a single pill, but a hidden threat that almost no one talks about. Number 1. Anticholinergic polypharmacy. This is the hidden danger that contributes more to drug-induced dementia than any single pill. The most dangerous medication for your brain is not one drug. It is the silent, combined effect of taking multiple medications with anticholinergic properties at the same time. This is known as anticholinergic polypharmacy. Consider this common scenario. A senior takes diphenhydramine for sleep, oxybutynin for bladder control, and amitriptyline for pain. Each drug on its own poses a risk. But when taken together, their effects compound, and the total anticholinergic burden on the brain becomes dangerously high. This is not a theory. In a 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That is more than double the risk. The worst part is that most of these seniors and their doctors are unaware of the cumulative danger. When acetylcholine is blocked from multiple directions, the brain's neurons begin to wither from underuse. Synapses shrink, and the brain enters a hypoactive state that looks identical to Alzheimer's disease. The solution is to request a full medication review from your doctor or pharmacist. They can use specialized tools and online calculators to determine the total anticholinergic load from all your prescriptions and over-the-counter drugs. Once the problem drugs are identified, a plan can be made to slowly deprescribe or switch to safer alternatives, rebalancing your brain chemistry. Here is the most hopeful message. Drug-induced dementia is often reversible. When the chemical burden is removed, many seniors experience a remarkable return of mental clarity and energy within weeks or months. Your brain is resilient, but you must give it the chance to heal. Polypharmacy is not just dangerous, it's preventable, and that makes it the number one hidden threat to the minds of our aging population. Now it is your turn to share. After hearing this information, which of these medications are you most concerned about? Have you noticed any of these cognitive changes in yourself or a loved one? Please share your thoughts and experiences in the comments below. Your story can help others in our community become more aware. Thank you for watching.